Today, I will talk about laws and their promise and limits in advancing women's rights to health. Common health problems of women. There are different ways of viewing women's health. One is the life stage approach, based on biological changes due to age, which traces changes in health from infancy to adulthood to the elderly stage. This frame, however, notes that certain problems remain constant across life stages, namely gender-based violence and depression. Another approach is focused on the problems causing the heaviest burdens, such as maternal mortality, cancers in general, especially breast and cervical cancers, sexually transmitted infections, and again, violence against women and depression. How about causality? What factors cause women's health problems? One analytic framework is the Social Determinants of Health Framework, or the SDH framework, which considers two types of determinants, structural and intermediary. Closest to outcomes on the right-hand side of the slide are the intermediary determinants, comprised of 1. People's living circumstances, whether they are acting as individuals, family, or community, and their relationship to the health system. Far off to the left of your slide are the structural determinants of health. First, the socio-political context, consisting of laws, policies, governance, and culture. And next to it are the social economic positions created by the context, differences in social class. For example, rich versus poor, women versus men, indigenous peoples versus non-indigenous peoples, educated versus non-educated, and all down the line. All of which inequities often override, if not determine, intermediary factors. Note that laws that define policies, governance, culture, and in this way social position can produce unequal health outcomes, including for women. Laws are considered a foundational determinant of health, shaping guiding principles, interventions, implementing mechanisms, and policies and programs, including financing and accountability. Yet laws are also the offshoot of higher laws, such as a country's constitution, the decisions of the Supreme Court, and international human rights laws. Human rights laws are universal agreements on the equal dignity and freedom of all human beings, including women. In their fidelity to the higher principles, laws can thus be considered as good laws, but they can also be bad laws. So what are women's human rights and human rights that are related to health? Women's human rights encompass all spheres of human affairs, public and private, and specific to health. These rights or freedoms and entitlements are considered key. These are 1. Freedom from discrimination and violence, or the assertion that women are equal in dignity and rights. Second is the right to the highest attainable standard of health, which has two parts. One is the right to enabling social determinants of health, and the other is the right to health care, described in 4 categories or 4 criteria: availability, accessibility, acceptability, and quality. So not just any healthcare will do. The third key right is the right to liberty, privacy, and security, or simply the right to autonomy, the right to make decisions for oneself, which is related to the fourth key right, which is the right to political participation and empowerment. And the fifth key right is the right to accountability or to responsible and accountable governance. Human rights is founded on the accountability of duty bearers, usually the state. Duty bearers have the power and the authority to design and implement policies, while rights claimers have the duty to participate. Rights claimers are those with little official powers, and they participate by making decisions of policymakers meaningful. Health professionals can be considered to have dual human rights functions. On the one hand, they are citizens entitled to responsive state policies and programs. But on the other hand, they have power over patients, families, communities, health policies, and they therefore have also the duties to respect, protect, and fulfill women's human rights. So what are the common laws affecting women in the Philippines? The Philippines is distinguished to have a number of laws against discrimination and violence against women. The first of this is the Magna Carta of Women, which defines the rights and entitlements of all women: rural women, fisherfolk, indigenous women, workers, women in sports and military. And the group that was omitted, unfortunately, are the lesbians, bisexuals, and transgenders. The Magna Carta is very explicit about government's ultimate accountability, and one avenue of fulfilling this is via the regular Gender and Development Budgets, or the GAD budgets. The second cluster of anti-vow laws are the anti-vowsy and the anti-rape laws. The anti-vowsy law of 2004 punishes all violence against women: physical, sexual, emotional, and financial. It is called a gender-specific law. It affects only women. It also mandates barangays or court protection orders and imposes imprisonment for months to years for the offender. The anti-rape law of 1997 defines rape as a crime against person, a public crime, not a private crime or a crime against honor. It also includes other acts such as penetration with objects, and it is considered a heinous crime, punishable by the most severe punishment, initially the death penalty, now life imprisonment. Under a separate law, LGUs and clinics are mandated to have rape crisis centers. This is the Rape Assistance and Protection Law. And a related law that was changed just this year is raising the age for statutory rape from 12 years old to 16 years old. A third anti-vow cluster of laws are the laws against sexual harassment and trafficking. The first anti-sexual harassment law punished unwanted sexual advances by superiors, whether these are in school, in workplaces, in training institutions. The amended law punishes sexual harassment in all public spaces, including streets, eating places like restaurants, and in cyberspace. It also punishes harassment by any other person, including peers and subordinates. Anti-trafficking laws, on the other hand, punishes the movement of women across national or international borders for sexual exploitation, forced labor, or slavery, including the traffic of body parts. The Anti-Trafficking Act was made more extensive through additional acts and processes in 2022, all these crimes, sexual harassment and anti-trafficking, are punishable by fines, heavy fines, and imprisonment. Second right is the right to health. Here are 3 examples of laws that intend to fulfill the rights to health by addressing 1, the social determinants, such as financing, and 2, enabling a multi-stakeholders participation. The UHC, or Universal Healthcare Law, delineates population from individual health, with the former now being funded by the DOH and LGUs, and the latter by PhilHealth. Both the amended HIV and Integrated Cancer Control Law mandate comprehensive services from promotion to rehabilitation, multi-stakeholder governing structures, and the active participation of constituents like PLHA and patients with cancer. The right to autonomy. Women's rights to autonomy is perhaps the weakest in terms of legal mechanisms. There is only the universal access to contraception for adult women and men in the reproductive health law, and this is offset by the explicit admonitions against minors having contraception unless they have parental consent. In the RH law, adolescents also have the right to comprehensive sexuality education. The amended HIV law has a stronger entitlement for minors because it allows minors 15 to 18 to access HIV testing without parents' consent. And this was used via what is known in legal parlance as the mature minors doctrine. What about women's participation in politics and all avenues of life? The encouragement and enabling of women's participation in all political processes, including labor and employment, is actually increased in the law. In 1991, women were recognized as equal partners in development, and governments were mandated to support them, including through the allocation of 5 to 30% of government budget. In 2013, kasambahays or domestic workers were entitled to proper wages, day off, and punishment of any maltreatment. And 3 years ago, maternity leave was increased from 60 days to 105 days, regardless of the worker's civil status or the phase of pregnancy. Miscarriage or premature termination, however, are subject to 60 days leave. And all of these leaves are to allow women to recuperate fully and to have time with their children. On the rights to accountability, while there is no specific law, most laws identify implementers and implementing processes, including participation by stakeholders. Many laws have penalties for violation, for example, through fines or imprisonment, or through administrative cases. Many of the laws require reports to Congress or to the President, and some have descriptive budgetary requirements, although none has a specific allocation, which probably redounds to the effectiveness of the law. Why do laws fail? Laws fail for many reasons. Number 1, if they're not consistent with gender equality and human rights, they will not be implemented at all or not widely. For examples are the law on abortion, which will probably have the same fate as the law restricting adolescents' access to contraception. Laws also fail if the implementation mechanisms are not sound. For example, when there are too many stakeholders required for implementation, which can contribute to inefficiency, when there is poor stakeholder participation or accountability, when there are no funds, when there is no attention to the social determinants like poverty and cultural restrictiveness, when the punishment for violations are so severe that even those who are wronged, like the victims of rape or violence, would rather not report it. So how is the global state of women's health now, 50 years after the agreement in Beijing on human rights of women in 1995? The assessment by a women's health group of experts globally that includes the WHO says the following. They say that some progress was made on women's political representation, economic participation, and some general health outcomes. However, they also said that the following structural barriers are so very deeply entrenched, notably inequalities, gender and social inequalities, power imbalances, harmful gender norms. Number 2, SRH, continuing to be a leading cause of disease. And thirdly, violence as the most frequent human rights abuse globally. So much has been done, but much needs to still be done. How can OBGYNs advance women's rights to health in law and policy? The call of the global health experts cited previously, as well as FIGO's leadership in 2020, are the following. Number 1 is to listen to women and girls, people that we see in our regular practice, and also to work with women and men to change gender norms. Number 2 is to advocate to our medical colleagues to integrate gender equality and women's rights to our code of ethics and practice. Number 3, that they should advocate for women's human rights as a structural determinant of health and health inequity, and convince government at all levels to fulfill women's rights by providing material, human, and financial resources. Finally, we can follow the call by Ruth De Leon, former president of the Panamanian Federation of OBGYN, to emphasize comprehensive health for women and girls, and within its context, sexual and reproductive rights as human rights, for women's body to be seen as a territory of autonomy and choice. Maraming salamat for listening.